Hello everybody, this is Gary. Today is March 7th, Monday 2022. It is 11:28 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I just wanted to do a quick video. I have a very busy schedule today. I have a dental appointment that I have to go to. They're probably going to do just a dental exam, and on my next visit, I think they're planning to pull out one of my teeth. I haven't set up that appointment yet. Tomorrow I have group therapy. It's called DBT therapy, or dialectic behavior therapy. It's just a type of therapy used to increase a person's tolerance of stress and stressful situations and symptoms of mental illness and stresses both internally and externally to the person. It's a way of dealing with high anxiety, high stress, high depression, high anger, high triggers for stress. And I missed last week's group, but I'm planning to go tomorrow's group. Last week I had a lot of pain in my right knee and I could barely walk on it, so I didn't go to group. But my knee feels fine for now, so I don't see any reason why I won't go to DBT group tomorrow, which is Tuesday, the 8th of March. On the 9th of March, I am seeing my psychotherapist. And on Thursday, on the 10th, I will be seeing my psychiatrist. We will be going over all my meds, including the progress I've made in taking Cymbalta 120 milligrams a day for physical pain, for nerve pain, muscle pain, joint pain, muscular skeletal pain, arthritis pain. I think the Cymbalta is working very well. It's an antidepressant, but it can be used to control several different kinds of physical pain, and I would have to say that my pain overall is a lot less than it was, say, 4, 5, 6 weeks ago. I've been in Cymbalta for almost 4 weeks now. We're at the maximum dose of 120 milligrams per day. I haven't really noticed any difference in my anxiety or depression, other than the fact that the pain has been relieved, which may or may not be related to my depression. I may have fibromyalgia. I don't know. I haven't got a diagnosis for the actual cause of all the physical pain. I mean, I know the cause of some of the physical pain is arthritis, bone spurs in my knees, arthritis in my spine, arthritis in my left hip. But that doesn't explain all of the pain that I was having, and to some extent I'm still having. Cymbalta is not a cure-all. It doesn't get rid of all my pain. It just gets rid of enough pain that makes life bearable. I wish I wouldn't have to take a medication for pain, but it is what it is. Maybe over the next couple of weeks it'll also help my depression and my anxiety. As far as my anxiety goes, I'm still taking Klonopin. As far as my psychosis, I'm still taking Zyprexa. I'm still taking Seroquel. I'm on several other medical medications that I'm on. I'm still taking those. I have physical therapy next Monday. I was going to go today, but I had the dental appointment, and I can't have 2 medical appointments on the same day. That's just an insurance rule, medical insurance rule. So I will be going to the dentist today. And as far as my psychiatric symptoms, they're not too bad today. My paranoia is not that high. My delusions are not that bad as far as I can tell. My anxiety levels are not that high. My depression is not that severe. My paranoia is not that bad. My auditory hallucinations are at a minimum. I'm able to function despite hearing voices. And I just took my new medications. It's not quite noon yet, but I took my new medications. I take my medications 3 times a day. I take my morning meds when I get up, depending on when I get up, around somewhere between 5 a.m. to 7 a.m. Then noon is my second set of medications, and I take all my other medications as I go to bed, except for the Klonopin and Zyprexa. I take those as needed when the anxiety and the psychosis and paranoia and hallucinations are really intense with the anxiety. Um, Insomnia has not been much of a problem. I've been sleeping at least 6, 7, sometimes 8 hours a night, which is better than no sleep at all, which used to be the case. Um, I don't know if that has something to do with the Cymbalta, if it's helped me sleep better because it's getting rid of my anxiety. I really don't know. This is a one day at a time sort of thing, watching what the Cymbalta does, what it doesn't do, what it helps with, what it doesn't help with. It's just a matter of living day to day and seeing what happens. So that's all for now. Like, comment, share, subscribe. If you want me to do a video on a specific topic, let me know in the comment section.